and gentlemen, welcome to Geneflux launch of MyDENKit and molecular services. I would now like to call upon Prof. Shamla to deliver her talk on the rising threat of dengue in Malaysia.
Most of our cases that are reported, more than half, are not confirmed by the laboratory. So what we really need is an early diagnostic test that will really be helpful. It will tell us right from the beginning, from day one of the disease, whether this is dengue or not. And this is what the MyDENKit is about. Dengue being an important disease, we really should try to confirm every single case that come to us.
Just to share with you, the dengue is not anymore a disease concerned to the Malaysia alone. So more than 100 countries have this problem. And so it's very important for the Malaysia to be the forerunner in trying to diagnose the disease so that we can come out with some solution. So you can see from the map here, global map, that so 50 to 100 million cases reported annually. Tropical infectious diseases will be more than 60% causative for any death happening in this region and in the whole world. So there is a greater participation from the government, there is a greater participation from the university and from the public sector and the private sector. And this is very important for the continued research and development, and we are completely committed for that. So in the 10 years, you are going to see a pipeline of products in the same scenario in the tropical infectious diseases and the other coronary and artery diseases. And just to highlight two methods, one is the virus isolation method and the second one is the serology test. And the main important point evident is the time duration. The duration or the time scale required for detection of a disease. So that is the whole point in healthcare industry. How quickly we diagnose the disease and the patient care can be started. So if that is delayed, then the lost time is the life lost. Any more delay will have any more deaths in the future, which will be the major bottleneck for any scientist to solve that outrightly. So like the disease spread takes the faster time because there are viruses involved, there are vectors involved. So that way the money spent fails to realize any results if we don't wake up and realize this technology. Very important that you make sure of the awareness, and since it is a large scale production one, so it can have an applicability in the 96 samples in less than 5 hours. So and also it can be adapted to the high throughput automation wherein we can do the analysis up to 384 and 1536 samples. So it can be stored in the hospitals, diagnostic centers and medical laboratories, and the recommended shelf life of the product is approximately 6 months. So high detection accuracy as human intervention is very low, and current lab and detection infrastructure can be reused. So there is no exclusively other than the PCR machine to be invested in this, because routine biochemical assays or whatever the hospitals are ongoing this is more than sufficient for this study and for these services. So overall cost effective solution, because even if you go for the immunodiagnostics one, the tests need to be repeated for all the members of the family and also at a regular intervals, because when the doctor starts or a clinician starts the prescription, so he will undergo and the fever may subside suddenly, and after 3 days it can reappear. So the tests need to be reconducted again. So thinking, because these are dependent on the antibody reaction, but here we are trying to detect the virus load directly, so it's more advantageous and more beneficial. We have tried it in the different labs, including in the different regions, because basically we wanted to make it a broad spectrum kind of appreciation. The serotype, which is named as 3 or 4 here, sometimes is confused or sometimes named as differently in the other countries. So that has also given us a kind of the feedback, and we are working towards it. The number of serotypes will increase, the number of strains and the mutants might increase in the future, and we are completely invested on the future products also, because once we change the particular batch to cater to the needs of a specific strain, and then it will be very easy for us to change. It's not like an antibody that the further research need to be done. There are 8 countries which have accepted this and validated in their laboratory with a specificity of 100% and the sensitivity with on an average from 75 to 85%. So which is more than enough what we have tried in our lab. So the patient sample preparation and the labeling will take 10 minutes. So if you just count in our duration required for each of the steps, so it's around 5 hours. So less than 6 hours, the cold report will be on your email. Of course, there are other private sectors we are also approaching us for the presentations. So we are just waiting for the launch, and we are approaching the other stakeholders like the medical centers and the hospitals and the diagnostics labs and specialty centers. Some of the medical colleges and the blood banks are also interested because they wanted to make it a mandate now to check, like HIV or other viruses. They want to make it a mandate to check for this virus, because whenever this blood is transfused to the organ transplant patients, then it becomes very serious case. So it can lead to the fatality of the patient. Distinguished collaborator Professor Shamla is looking after the other alternate medicines using the natural products and the vaccine development. So we're actively working with them to come out with the drug discovery and the therapeutics so that it can be solved at the grassroots level itself. The collaborations which are confirmed and agreements are signed is the marketing and distribution. We are actively working on that because manufacture hub will be Malaysia. We want the channel partners and the distributors on the other countries also. So we have worked with India and in US, and also we continued research and development for any mutant strains or the new serotypes evolved. This is developed by our own people for our own people. So it's a very good initiative. We proudly and we are very happy to launch this product in today's BioMalaysia 2008. So I want proudly announce the product development team which have actively worked for the past 6 to 8 months, and Dr. Geeta is our project coordinator, which is funded by the Ministry of Science and Technology and Innovation. So I acknowledge our distinguished funding agency, Ministry of Science, Technology, Innovation, and our collaborator, Department of Medical Microbiology, and the TPM Biotechnology, where we have launched our services in Technology Park of Malaysia Biotech.
We are engaged in the development of emerging technologies and molecular diagnostic kits through innovative and collaborative research. We have a molecular biology lab based in the TPM complex in Bukit Jalil. This is both a lab as well as a manufacturing unit for us. At the same time, we have also a branch office in India, Geneflux India, which is based in Bangalore, where we do our bioinformatics work. We have also got a branch in US, in Geneflux USA, which is based in Maryland, USA, and which is focusing on pharmaceutical products. We are confident that we can actually set new benchmarks in innovation and technology to exemplify the tremendous progress that we see in the Malaysian biotechnology field. Today we are launching the MyDENKit. Very soon we are already working on other kits, things like the MRSA Flux, the MyCMV kit, and even services for screening and all that. These are all now ongoing, and these should be coming out in the next few months. I would like to thank Professor Zakaria and Professor Shamla from University of Malaya for their continued support. Dr. Muhammad Isa from MOSTI for his continued encouragement and appreciation. J. Zamri Osman from Biotech Corp for their guidance. I would also like to thank the BioMalaysia 2008 Organizing Committee for allowing and providing us an opportunity to launch our products.
Sorry, I would like to invite Dr. Isa to officially launch MyDENKit.